Hi, I'm Dr. Johnny. Thanks for joining me today. I'm talking about lip fillers at home. A lot of people have asked me to comment, what do I think? Tell us about it. Show us how to do our lip fillers at home. I'm going to talk about it today. Let's get started. Lip fillers at home, all about it in 3 seconds. Okay, so if you like the videos, click like, make sure you subscribe and click the bell. We do all kinds of videos on your skincare, your beauty, angles, PDO threads, the whole gamut to keep your skin and body beautiful, healthy, and vibrant. Today, my opinion on lip fillers at home. I think there's a lot to this. First of all, a caveat in this, to me, people that do things in their own home, they're not harming other people. That's better than doing them to other people where you can cause harm. The reason I say it, and there's cases, you can go Google this and read the news, or I have patients that come into me, my own patients who've been gone elsewhere and had these home treatments, and I understand that you can get treatments in RVs and homes. There's nothing inherently wrong about it, but it's particularly no pre-pictures, uneducated people doing it, or those without the basically illegally doing it. And I'm going to go through 4 things to consider before you do this at home or on yourself, or have somebody, a friend, do it. Certainly there have been deaths. This isn't a scare video, but you can Google these things. The cases that I've seen of my patients, yes, other products have blown up in their face and they've had granulomas and had to go on steroids and different things. And I'm going to tell you a couple of reasons why that may have happened and to be cautious about it. But personally, my patients come see me for my expertise. They get along with me. They understand I'm going to do what's safe. I'm going to bring things into their practice so that they look good for long periods of time, and we have a discussion over what we're going to do that makes sense, that's safe. I'm not threatened if people want to do their own treatments at home, or it's more cost effective, or I'm not worried about going out of business or anything like that. I'm long beyond those issues. But I thought it's worthwhile to talk about a few of the things to be careful about. So number 1, and the first thing, I guess there's 2, 1A and 1B. 2 things that strike me the most that I get concerned about when it happens to my patients, or I have friends who contact me, hey, I made a mistake. People get scared. Even if things don't go wrong and they're uncertain, the mind starts to go, you will go on Google and you're scared. So the number 1 is, where did the product come from? And I know there's sites that have product from overseas, or they say it's the same product in the US, or it might be just across the border in Canada. Nothing wrong with Canadian product. The problem is it's really hard to authenticate that that's really the way. And product that isn't real and legitimate from the company within the country where it comes from, there's no control on that. And the companies themselves, when they dissect the product, have to go to the microscopic level to know. And I worry about the product having some permanent components that can have reaction to it. And the B part of this is bloodborne illness with the needles. And if you're getting it from someone else, this happens where people share needles. I mean, that's still hepatitis, HIV, all kinds of illnesses that are bloodborne. So that's the number 1 thing that scares me, that's acute, to keep in mind and be aware of. What's going into your face, you get one body, and particularly one face, don't mess it up. Number 2, things happen like occlusion. And there's people out there that say, if you know your anatomy, you know safety, you have confidence. I know my anatomy, but I don't feel safe and confident. I'm always watching for signs of occlusion for doing this for 20 years, and you can get fooled. So anatomy is aberrant. What it shows you in the book, when you do cadaver dissections and when you real life inject people, you know, for instance, lip fillers are common. 2 or 3, up to 4 or 5% of the artery that supplies the lip will be in front of the muscle, anterior. So if you just take 5% as a round number, 5 in 100, 1 in 20. That's a lot of lips that are going to have aberrant vessels. When you hit those, you can see, here's a picture of necrosis. This is the real deal. When it happens, you have minutes to hours to act for most people, and there are subtle signs. Why do I think they're subtle signs? Because people contact me with issues, problems, side effects all the time because I've done it a while, I teach, people know me, and I get to pull the data from so many different people on the nuances, and we talk back and forth. These are very smart people. Do you think it is? Do you think it isn't? Here's a history. If you're just doing this once in a while, there's no way you have the breadth of knowledge to know exactly what to look for. When bad things happen, I can tell you, when it goes south, people get scared and they need things done quickly. And there's mental fortitude you have to do this at home and be okay with it. So be mindful of that. I think number 3 is seeing the face from 3 dimensions and being able to put the syringe where you need and the depth you need consistently to be safe and get the results. So it's hard to do that on yourself without a 3D camera looking from the side view, because it's not just looking good from the front, it's looking good from the side angles. And it's very hard in a mirror or however you're doing it to get perfection of the filler. Lumps, bumps, and nodules occur. So one would at least need dissolver, and you hope that it's real product, because if it's not, you can't dissolve it. There's bioalchemy, there's PMMA, there's other products in other countries that certainly come over here, and you cannot dissolve that with Hylenex, okay? Calcium products. So that would be another. There's angles, knowing how you're looking over time, and you find sometimes people injecting themselves can start to look a little bit bizarre. Sometimes it takes that third person look and to give you an idea of the angles and what you should be doing for beauty. Finally, the best results are often achieved with combinations. So a lot of times, not only are we switching gears with how we inject, might start with the wet dry, might inject a little at the GK, reassess it, do more, might then go to the pillar technique, based on experience and artistic experience of what we can achieve with each method, and adding something else. So if we're not getting the projection we want, I might add a PDO thread. I might add platelet-rich fibrin or plasma lip to get what I want, because there's wrinkles on the lip or the lip isn't pink enough. So often there's combinations. We're using radio frequency like Plump RF, a device on the lip to get a better result. So combinations in a clinic, you can just grab the device and add, and that leads to ultimate results. So it's all about results. So there's much more to talk about, and I'd like to hear what you have to say. Again, if you'd like to inject yourself at home, power to you if that's what you want to do. Try not to inject other people. I think that's dangerous. If you're not licensed, you're not trained aesthetically, that's bad form. But let me know what your thoughts are on that, and what are some of the other dangers. What's your experience has been. We all learn here from each other. We're all pooling information and data. I want to thank you for joining the channel. Like if you like the video. Click subscribe, of course, and stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.